Part 3 for our rapid review in key association of disease and associated findings. For disseminated intravascular coagulopathy, commonly associated with severe sepsis, obstetric complications, cancer, burns, trauma, major surgery, acute pancreatitis, and acute APL or acute promyolocytic leukemia. For malignancy associated with non-infectious fever, most common is Hodgkin's lymphoma. Type of Hodgkin's lymphoma, we commonly associated with nodular sclerosis. This is mixed cellularity versus lymphocytic predominance versus lymphocytic depletion. For chromosomal translocation 14 and T14 and 18, follicular lymphoma is the most commonly associated disease. The B-cell lymphoma 2 activation, anti-apoptotic oncogene for follicular lymphomas. For chromosomal translocation 814, associated commonly with Burkitt lymphoma, MYC fusion transcription factor oncogene. For type of non-Hodgkin's lymphoma, associated with diffuse large B-cell lymphoma. For primary bone tumor in adults, commonly associated with multiple myeloma. Age ranges for patients with leukemia, the acute lymphoblastic leukemia, chronic lymphocytic leukemia, the acute myeloid leukemia, and the chronic myelogenous leukemia. For the ALL, common to the child. For the CLL, common for adults greater than 60-year-old. AML, common for adult 65-year-old. And CML, common for adult 45 to 85-year-old. Malignancy for kids, common are leukemia and brain tumor. Death in CML, commonly associated with blast crisis. For chromosomal translocation 922, commonly associated with Philadelphia chromosome, CML, that is BCR-ABL oncogene, tyrosine kinase activation. More rarely associated with ALL. Vertebral compression fracture, commonly associated with osteoporosis. The type 1 osteoporosis for postmenopausal women, the type 2 osteoporosis for elderly men or women. HLA, human leukocyte antigen B27, commonly associated with psoriatic arthritis, ankylosing spondylitis, IBD, irritable bowel disease associated with arthritis, reactive arthritis, formerly Reiter syndrome. For death in SLE is commonly associated with lupus nephropathy. For tumor in infancy, common association is strawberry hemangioma, grows rapidly and regresses spontaneously by childhood. For actinic solar keratosis, commonly associated with precursor to squamous cell carcinoma. Cerebellar tonsillar herniation, commonly associated with Chiari 1 malformation. For atrophy of the mammillary bodies, common association is Wernicke's encephalopathy, that is thiamine deficiency causing ataxia, ophthalmoplegia, and confusion. So these are the triad of Wernicke's encephalopathy: ataxia, ophthalmoplegia, confusion. Epidural hematoma, commonly associated with rupture of middle meningeal artery because of trauma, lentiform shaped. For subdural hematoma, rupture of bridging veins, that is crescent shape. Rupture of bridging veins, crescent shape, subdural hematoma. Dementia is commonly associated with Alzheimer's disease, multiple infarcts, vascular dementia. Demyelinating disease in young women, commonly associated with multiple sclerosis. Brain tumor in adults, supratentorial is a common association. Metastasis, this is a metastasis, astrocytoma including glioblastoma or multiforme, meningioma, and schwannoma that will occur at a supratentorial brain tumor in adults. Pituitary tumor, associated commonly with prolactinoma, somatotropic adenoma. Brain tumor in kids, commonly in the infratentorial, such as medulloblastoma, that is in cerebellum, or supratentorial, that is craniopharyngioma. Mixed upper motor neuron and lower motor neuron disease, commonly associated with amyotrophic lateral sclerosis. For nephrotic syndrome in adults, is a common association is membranous nephropathy. For nephrotic syndrome in kids, common association is minimal change disease. For glomerulonephritis in adults, associated with Berger's disease, IgA nephropathy. Kidney stones is commonly caused or associated with calcium. The lab for X-ray is radio-opaque. Strovite or ammonium. Strovite is caused by ammonium. Radio-opaque formed by urease positive organisms such as Klebsiella, Proteus species, and S. saprophyticus. So this is a strovite stone is caused by an infection of this bacteria. If the kidney stone is uric acid, it is radiolucent, and if the kidney stone is composed of cystine, that is faintly radio-opaque. Cystine, faintly radio-opaque, uric acid, radiolucent, struvite, radio-opaque, calcium, radio-opaque. Renal tumor, commonly associated with renal cell carcinoma, associated with von Hippel-Lindau and cigarette smoking, paraneoplastic syndrome, EPO, renin, and parathyroid hormone releasing protein. Then the ACTH, adrenocorticotropic hormone. Obstruction of male urinary tract, benign prostatic hyperplasia. That is the common associated disease for obstruction of male urinary tract. Primary amenorrhea, Turner syndrome. That is a chromosomal aberration in the 45 chromosomes or 45XO, 46XX mosaic. XX mosaic, XO, 46, XO or 45, 45. Neuron migration failure, Kallmann syndrome. That is hypogonadotropic, hypogonadism, and anosmia. So Kallmann syndrome is a neuron migration failure association. Clear cell adenocarcinoma of the vagina is the diethylstilbestrol exposure in utero. Clear cell adenocarcinoma of the vagina is DES exposure in utero, commonly associated with. Ovarian tumor, benign and bilateral, is associated commonly with serous cyst adenoma. Ovarian tumor, malignant, is commonly associated with serous cyst adenocarcinoma. Serous cyst adenocarcinoma. Tumor in women, leiomyoma, estrogen dependent and not precancerous. Tumor in women, leiomyoma, not precancerous. Gynecologic malignancy, endometrial carcinoma, most common in US. Cervical carcinoma, most common worldwide. Breast mass, commonly associated with fibrocystic change, carcinoma in postmenopausal women. Carcinoma in postmenopausal women, breast mass. Breast tumor, benign young woman, is fibroadenoma. Common findings is fibroadenoma. Breast cancer, invasive ductal carcinoma, IDC, invasive ductal carcinoma is the most common breast cancer. Testicular tumor, most common is seminoma, malignant and radiosensitive. Increased placental alkaline phosphatase. that is for testicular tumor. Thank you. The source of this rapid review upon hearing this review while driving is from the USMLE First Aid, copyright 2019.